When you go to donate blood, the nurses will ask you,
3 months cumulatively in the United Kingdom from 1980 and 1996.
Even in contact with monkeys or monkey products?
You had sex with another man?
Currently stands, gay men are unable to donate blood in Canada unless they have abstained from sex for 5 years. Is this justified? Other risk behaviors, such as getting a tattoo or a piercing, only have a 1-year exclusion period. So why are gay men considered to be higher risk? We'll investigate these questions and seek to propose solutions to this problem.
The law regarding gay men donating blood and the exclusion from it was implemented in 1988. At this time, little was known about HIV and AIDS. Gay men represented 61% of all new cases, and there is virtually no test in order to detect for it. Therefore, this is the only way at the time to maintain the safety in the blood supply. Since then, the Canadian Red Cross Society now uses 3 different tests to test for HIV and AIDS that are between 99 and 100% effective. The window period for infection has dropped from 6 to 8 weeks to 11 days, and the risk of transfusion infection from HIV-infected blood is estimated to be 1 unit per 4.7 million donations. Although the MSM community still represents the highest number of new cases of HIV infection at 39.6%, it has dropped every year since 2001. With tests that virtually guarantee that HIV-infected blood will not enter the blood supply, exposes the arbitrariness of the categorical exclusion of donations from gay men. The policies restricting gay men from donating blood are certainly outdated and lacking scientific evidence. Therefore, overall, it's clear to see that this is certainly a discriminatory policy.
1977 is the year that HIV/AIDS emerged. Later, it was determined that Haitians, men who have sex with men, and intravenous drug users were at risk for HIV. To avoid discrimination, pamphlets were introduced outlining the at-risk populations and in the hopes that they would self-exclude. Thousands of Canadians were infected by blood transfusions, and in the late 80s, the deferral of men who have sex with men and blood screening was introduced.
Public concern about government action related to blood safety is still a controversial issue today. Gay rights activists argue that the laboratory testing of blood is so accurate that continued deferrals based upon sexual activity are unjust. Equality Maine Director Alisha Johnson believes that the policy is still based on stigma instead of science. She says a lot of people are pretty upset. I think that what perpetuates is the notion that being gay in itself is a risk, and that's a really scary message to be sending to people. It's not true. Mark Robbins, who is the editor of Gay Vancouver, believes that the new policy implemented recently is still hypocritical. He says HIV/AIDS is not a gay disease. Why don't they prevent heterosexuals who have had sex from donating blood? There are increased blood shortages, and a ban continues to stigmatize gay men. Even though there is a constant scrutiny against the ban of gay men towards donating blood, many people feel justified in keeping the ban to increase the safety of patients. For example, the Terence Higgins Trust, the leading HIV and AIDS charity in the UK, stated that the potential harm to a recipient of HIV-infected blood when there is no cure and it is a potentially life-threatening condition outweighs the harm caused by people not being able to donate blood.
Okay, the first method of blood screening came about in 1985 after they ID'd HIV, and the researchers developed the first antibody screening tests called enzyme-linked immunoabsorbent assay, and it allows them to determine whether blood is infected or not based on the presence of anti-HIV antibodies. In 2003, the North Carolina Department of Health and Human Services implemented their screening and tracing active transmission program, which screens the RNA, which is able to detect the virus itself rather than the anti-HIV antibodies, which makes the detection more accurate because anti-HIV antibodies sometimes aren't present or detectable until a few months after infection, which leads to many false positives if tested too early. In contrast to blood screening, professionals have also used pre-donation screening and donor health assessment questionnaires. This was used before they knew what to screen for in blood tests. And the method has become more efficient over the years because there is less fear among the general public of contracting HIV and AIDS than there was in the 80s.
According to UNAIDS community, the HIV is more common among gay and bisexual men than the general population all over the world. In North America, an estimated 15% of gay and bisexual men are infected with HIV. The HIV is more easily transmitted through unprotected anal intercourse than through vaginal intercourse. and men who report unprotected receptive anal intercourse are at increased risk of contracting the HIV virus. Generally, the receptive partners are at greater risk of contracting the HIV virus because the lining of rectum is thin and may allow the virus to enter the body through semen exchange. The inserted partner is also at greater risk because the virus can enter through urethra and small cuts on the penis. Also, the condoms are more likely to break during anal sex than during vaginal sex. Thus, even with a condom, anal sex can be risky. Gay men tend to have higher risk of contracting HIV due to increased probability of risky sexual behavior. One study estimates that if receptive anal intercourse was only as risky as vaginal intercourse, then the HIV cases would fall by 80 to 90% among gay and bisexual men over 5 years.
It has long been assumed that sexually active gay and bisexual men are at an inherently greater risk of contracting HIV and other sexually transmitted diseases, as was detailed in the last segment. However, this may no longer be the case. Pre-exposure prophylaxis, or PrEP, where high-risk individuals preemptively take antiretroviral medication, has proven to be extremely effective in combating the spread of HIV. A recent study showed that with a regimen of 7 doses a week, risk factors can be reduced by 99%. A recent study conducted in Sydney, Australia, surveyed 1,427 men who have sex with men. This study found that among these men who reported condomless anal intercourse, there was a clear pattern of HIV risk reduction behavior. The researchers reported that condomless anal intercourse most often occurred between regular partners. It was shown that they tended to serosort and only have sex with people of the same HIV status as them. Many also used pre-exposure prophylaxis as mentioned previously. The study concluded that condomless anal intercourse alone was not enough to conclude on one person's risk of HIV.
HIV is an RNA retrovirus of the family Retroviridae. HIV can infect many types of cells, though it primarily infects the immune system. Transmission most commonly occurs through blood or contact through mucosal membranes. Oral transmission of HIV is far rarer than bloodborne or sexual transmission. The hypotonic environment of saliva combined with sulfuryl component antibodies and proteins has been theorized to inhibit the virus's ability to survive and replicate. Saliva contains active HIV particles in only 1 to 5% of HIV cases. These mitigating effects are reduced with the addition of isotonic substances such as breast milk or semen. Oral transmission of HIV is therefore possible through breastfeeding or oral sex. HIV enters the body through infected white blood cells or virus particles contained in the body fluids of an infected person. The virus inserts its genetic information into the host cell and uses it to create more virus particles. The presence of other sexually transmitted infections increases the risk of transmitting HIV. Depression and substance use have both been linked to a greater risk of HIV exposure in men who have sex with men. Treatment with antiretroviral drugs has been demonstrated to reduce the risk of HIV transmission.
Though there is no cure for HIV, the use of antiretroviral drugs have allowed for it to become a manageable chronic disease. Its highly active antiviral therapy uses a cocktail of different drugs to attack the virus. There are 5 different types of drugs that are used throughout these classes. The first is fusion inhibitors, which prevent the HIV-1 virus from binding to the host cell. The second is nucleotide reverse transcription inhibitors, which prevent reverse transcription, therefore the virus is unable to fuse with the cell's nucleus. Non-nucleotide reverse transcription inhibitors use non-competitive inhibitors which bind to the active protein site in replacement of the HIV virus. Integrase inhibitors prevent the enzyme integrase from entering the cell's DNA, where protease inhibitors stop protease enzymes from binding to the host cell. The correct use and combination of these 5 drugs can lead to a successful antiretroviral treatment, ultimately improving the lives and lengthening the lives of those living with HIV.
This issue relates both science and society because there is a disconnect between men who have sex with men's scientifically confirmed risk and their perceived risk by society. The current policies towards MSM are based on outdated scientific information and should be changed to better reflect the current scientific consensus.
Although there still remains to be considerable controversy, the law restricting gay men from donating blood is discriminatory and unjust. Since 1988, when the law was initially enforced, science and society has progressed in a number of ways. Heterosexual individuals are increasingly more accepting of homosexuals, and the majority of the community believes the health regulations to be outdated. Due to substantial technological advancements, several ways of identifying and preventing HIV have been developed, resulting in 99% detection rate. With this being said, gay men should be provided the same opportunities as heterosexuals in the event of saving lives through blood donations in the healthcare system.